Gentlemen, I want to ask you something today that most men your age have quietly wondered about but almost never ask out loud. Not to their doctor, not even to their partner. How often should a man over 60 actually be having sex? And I don't mean what is socially acceptable, or what your neighbor implies at dinner, or what the culture suggests a man your age should want or not want. I mean, what does the science actually say about frequency, intimate health, and what is genuinely optimal for your body at this stage of life? Because here is what I can tell you from over 14 years of sitting across from men in their 50s, 60s, and 70s in a clinical setting. Almost every man in this age group has a number in his head, a frequency he thinks he should be hitting. And almost every one of those men feels quietly ashamed that he isn't hitting it, quietly confused about what is normal, and quietly convinced that whatever he is currently experiencing represents some kind of personal failure. Today, I am going to replace that shame with science. And what I am going to tell you is going to surprise you, in the best possible way. Here is the myth I want to dismantle before we go any further. The myth is this, that there is a correct, universal number of times per week or per month that a man over 60 should be having sex, and that falling below it means something is wrong with him, his relationship, or his health. I understand completely where this myth comes from. It comes from comparison. From the numbers men hear in locker rooms at 30 that somehow become the permanent benchmark. From cultural messaging that equates frequency with virility and virility with worth. From the anxiety of noticing that things have changed and wondering what that change means. But here is what the research actually shows. The relationship between intimate frequency and health outcomes in men over 60 is not a simple more is better equation. It is nuanced, individual, and far more connected to quality, consistency, and physical context than to any specific number. The man who is intimate twice a month in a fully engaged, connected way is doing something biologically and emotionally different, and in many respects better, than the man chasing a number he read somewhere while feeling disconnected from his own body. What matters is not the scoreboard. What matters is what is actually happening when you get there, and how your body, your relationship, and your sense of self are being served by it. That is what we are going to talk about today. For those of you who are new here, I'm Dr. Mariana. I'm a board certified urologist and men's health specialist with over 14 years of clinical experience working directly with men at exactly this stage of life. Men who came to me carrying questions they had never been able to ask anyone, carrying shame they had never been invited to set down. I built this channel because I believe that men over 50 deserve the same quality of honest, complete, science grounded health information that has historically been far more available to women, and I intend to keep providing it. My job today is not to tell you what your intimate life should look like. It is to give you the biological and psychological framework to make informed, confident decisions about it yourself. That is always the goal here. Before we get into the science, hit that like button right now if you appreciate straightforward, evidence-based men's health content that actually respects your intelligence. Subscribe so you never miss a new video. I post every single week. And drop a comment telling me where in the world you are watching from today. I genuinely love seeing how far this community of wise, health-forward men reaches. Now let's get into it. The first thing the research tells us, and this is where most men are genuinely surprised, is that for men over 60, the health benefits of intimate activity are real, measurable, and significant across multiple biological systems. But they are not primarily determined by frequency. They are determined by regularity and engagement. Here is the biology. Intimate activity in men triggers a cascade of hormonal events that have downstream effects on cardiovascular health, immune function, testosterone maintenance, sleep quality, and stress hormone regulation. During and after intimacy, the body releases oxytocin, dopamine, and endorphins, compounds that reduce cortisol, lower blood pressure, support immune activity, and produce the kind of deep nervous system recovery that mirrors the effects of quality sleep. Think of it like a full system reset, not just pleasure, an actual biological maintenance event that your body uses to recalibrate multiple systems simultaneously. Studies have found that men who engage in regular intimate activity, regardless of the specific frequency, show lower rates of cardiovascular disease, reduced inflammatory markers, better prostate health outcomes, and higher reported well-being than men who are sexually inactive. The key word in all of that research is regular, consistent, not absent and not obsessively frequent, regular. This matters emotionally because so many men over 60 have quietly accepted a version of sexual resignation, a belief that this part of their life is winding down and there is nothing to be done about it. That resignation is not just emotionally costly, it is biologically costly. The body uses intimate activity as a signal that its reproductive and vascular systems are worth maintaining. When that signal disappears entirely, maintenance attention shifts away from those systems. This is not metaphor. This is how the body allocates its biological resources. Practically, the action here is to resist the pull of all or nothing thinking. If frequency has declined, the goal is not to suddenly manufacture a number that feels artificial and pressured. The goal is to maintain regularity, whatever form that takes at this stage of your life, because regularity is what delivers the biological dividend. Even once every 10 to 14 days, sustained consistently, produces measurable health benefits. The number is far less important than the consistency. The second thing to understand is what the research actually suggests about optimal frequency ranges for men in this age group. Because while I have just told you that a specific number is less important than you thought, I also want to give you the honest data so you have a real framework to work from. The most comprehensive longitudinal studies on male intimate health and aging consistently show that men over 60 who engage in intimate activity, including both partnered intimacy and solo intimacy, 1 to 3 times per week, show the strongest health outcome associations. Think of this range not as a prescription, but as a biological sweet spot, the frequency at which the hormonal, cardiovascular, and immune benefits are most reliably triggered, without the physical or hormonal depletion that can come from significantly higher frequencies in older men. Below once per week on a sustained basis, some of the tissue health benefits, particularly those related to maintaining the elasticity and vascular responsiveness of erectile tissue, begin to diminish. Above 4 to 5 times per week on a sustained basis, some men in this age group show signs of testosterone drawdown that temporarily suppress libido and energy in the days following. Think of it like exercise. The optimal training zone for a 65-year-old is not the same as for a 25-year-old. More is not always more. The right amount, consistently applied, produces the best long-term results. The emotional relevance of this is significant. Many men in their 60s and 70s have internalized a comparison number from earlier decades of their lives, and the gap between that number and their current reality feels like evidence of decline. What the data actually shows is that the frequency range most associated with positive health outcomes in this age group is entirely achievable, sustainable, and not dramatically different from what most men in functioning partnerships are already experiencing. You are likely closer to optimal than you think, and understanding that removes a layer of unnecessary pressure that was itself working against you. Practically, if you are currently within the 1 to 3 times per week range, you are in the research-supported zone. Your goal is consistency and quality, not escalation. If you are below this range and would like to increase frequency for health reasons, the most effective approach is addressing the underlying factors: libido, energy, hormonal levels, relationship connection, rather than forcing frequency as an endpoint in itself. The third thing most men over 60 are never told is that solo intimacy counts, biologically, fully, and without qualification, and that this fact has profound implications for men who are unpartnered, whose partners have different frequency preferences, or who are navigating a period of reduced partnered intimacy for any reason. The tissue health benefits of intimate activity. The regular engorgement of erectile tissue with blood that maintains its elasticity, vascular responsiveness, and overall health are produced by the physical event itself, regardless of whether a partner is present. Think of it the way you would think of physical therapy for an injured joint. The therapeutic value comes from the movement, the circulation, the mechanical engagement of the tissue. The context around it is emotionally significant but biologically secondary. Research on men recovering from prostate surgery, men in long-distance relationships, and men navigating partner illness has consistently found that regular solo intimacy maintains erectile tissue health, reduces recovery time from periods of inactivity, and supports the vascular responsiveness that partnered intimacy then draws on. Your body does not distinguish between the two in terms of tissue maintenance. The biological dividend is real either way. I want to address the shame that some men carry around solo intimacy at this age, because it is real, it is common, and it is completely unwarranted. The cultural messaging that men at 60 or 70 should have moved beyond this is not grounded in biology. It is grounded in discomfort. There is nothing in the science of male aging that supports the idea that solo intimacy becomes inappropriate or unhealthy with age. Quite the opposite. For men in circumstances where partnered intimacy is infrequent or unavailable, regular solo intimacy is a legitimate, medically sound form of self-care. Your dignity as a man is not diminished by it. It is, in a real sense, supported by it. Practically, if you are in a period of reduced partnered intimacy, for any reason, maintain a solo intimacy practice of once to twice per week. This is not a consolation, it is a health practice. Approach it that way. I want to pause here for a moment. Of the three things we have covered so far, the health benefits of regularity, the optimal frequency range, and the validity of solo intimacy, which one shifted something for you? Drop your honest response in the comments. I read every single one, and this is exactly the kind of conversation that helps other men in this community feel less alone with questions they have never been able to ask. Now let's keep going. The fourth thing I want to address is something that operates quietly beneath most conversations about intimate frequency, and it is one of the most important drivers of what actually happens in this area of life after 60. It is libido, and specifically, the biological mechanisms that are silently suppressing it in ways most men have never had explained to them. Libido, sexual desire, is not primarily a psychological phenomenon in men. It is a hormonal one. Testosterone is the primary driver of male sexual desire, and as we have discussed on this channel before, testosterone declines at approximately 1% per year after 30. By 60, most men have lost between 25 and 35% of their peak testosterone. Below a certain threshold, which varies by individual but is clinically real, desire does not arise naturally. The engine does not start because the fuel level is too low. Think of it exactly that way. A car with sufficient fuel idles naturally and starts reliably. A car running on a near-empty tank requires significant effort to get moving and may not sustain a journey the way it once did. If a man's libido has declined significantly, the problem is almost never that he has lost interest in intimacy as a concept. The problem is that the hormonal signal that used to arise spontaneously has become unreliable. And that is a biological reality, with biological solutions. This matters enormously for men's self-perception. So many men interpret reduced spontaneous desire as evidence that they are no longer a sexual being, that something fundamental about who they are has been lost. This interpretation is painful, private, and wrong. What has changed is a hormone level, not an identity, not a value, a measurable, addressable biological variable. Practically, if libido has declined noticeably, if desire arises rarely or not at all spontaneously, begin with a conversation with your physician about testosterone levels. Request a full panel: total testosterone, free testosterone, SHBG, and estradiol. These four numbers together give a complete hormonal picture that a total testosterone reading alone does not. While awaiting or alongside medical guidance, the lifestyle supports with the strongest evidence for naturally supporting testosterone in this age group are resistance exercise 3 times per week, zinc supplementation at 25 to 40 milligrams daily, quality sleep of 7 to 8 hours with a consistent wake time, and reduction of alcohol consumption. These are not minor adjustments. Each one has documented testosterone supportive effects that compound over weeks and months. The fifth thing I want to address is the role of the partner, and specifically the conversation that most couples over 60 are not having, but urgently need to. Because in many relationships at this stage, the intimate frequency question is not just a personal health question, it is a relational one. And the gap between what each partner needs, expects, and is afraid to say is often wider than either person realizes. Research on intimate relationships in men and women over 16 consistently shows that desire, frequency preferences, and the meaning attached to intimate activity often diverge significantly by midlife, and that this divergence is frequently left unaddressed out of avoidance, assumption, or fear of causing hurt. Men worry their partners will feel pressured. Women worry their partners will feel rejected. Both stay quiet, and the quiet accumulates into distance, resentment, and a growing sense that something important has been lost, when what has actually been lost is simply the conversation. Think of a relationship as a living system that requires regular, honest recalibration. Like any system left without maintenance, it does not stay where it is, it drifts. The drift in intimate relationships at this stage of life is usually slow, quiet, and entirely reversible once the conversation begins. The emotional weight of this for men specifically is significant. A man who interprets his partner's reduced frequency as rejection, rather than as her own biological and emotional navigation of this life stage, carries that misinterpretation as a private wound that shapes everything from his self-esteem to his willingness to initiate. Getting the truth, even if the truth is complicated, is almost always better than the story the silence creates. Practically, the most important action here is a specific kind of conversation, not a confrontation, not a complaint, but a genuine curious inquiry. Something as simple as, I want to talk about our intimate life, not because something is wrong, but because I want to understand what works for both of us at this point. That framing, curious, collaborative, non-accusatory, opens a door that avoidance has been quietly closing. If this conversation feels impossible in your relationship, a single session with a couples therapist or sex therapist who specializes in midlife relationships can provide the structure to have it safely. That investment pays dividends across every other dimension of the relationship. The sixth point brings together everything we have discussed and addresses the question that is actually underneath the question most men ask about frequency. It is not really, how often should I be having sex? It is, am I still the man I was? Is this part of my life still available to me? And does what I am experiencing mean something is wrong? I want to answer all three of those questions directly. You are still the man you were, with more experience, more self-knowledge, and frankly, more capacity for the kind of intimate connection that younger men are still working toward. This part of your life is still fully available to you. Not identically to how it was at 40, but genuinely, meaningfully, and with a depth that frequency alone could never capture. And what you are experiencing, the changes in desire, frequency, reliability, and the emotional landscape around intimacy, does not mean something is wrong. It means you are navigating one of the most significant biological transitions of male life with the information available to you at the time. What I hope today has done is improve that information significantly. The dignity of a man's intimate life does not expire at 60 or 70. It evolves. It asks for more intention, more communication, more willingness to understand the biology and work with it, rather than against it. Men who make that shift, who move from chasing a number to engaging with intention, consistently report that the quality of their intimate lives in their 60s and 70s exceeds what they experienced in their 40s. Not in frequency, in depth, in connection, in the quiet confidence that comes from knowing your own body and being genuinely present with another person. That is available to you. It is being built right now, in the choices you make about how to understand and care for yourself. I want to share something real with you. One of my patients, I will call him William, 67 years old, came to see me 18 months ago at the insistence of his wife, who was concerned about what she described as his withdrawal. He had not initiated intimacy in almost 4 months. He had told himself he was tired, that he had lost interest, that this was simply what 67 looked like. But when I sat with him and we talked honestly, what emerged was something different. He had experienced 2 episodes of unreliable firmness the previous year. Both had humiliated him privately, and his response had been to withdraw entirely, to take himself out of the game rather than risk the experience of failing in front of his wife again. He was not disinterested in his wife, he was terrified of disappointing her, and his silence had led her to believe exactly the opposite of the truth. We addressed the vascular factors contributing to his unreliable firmness: sleep, diet, pelvic floor work, a medication adjustment with his cardiologist. We talked about the anxiety loop and how to interrupt it, and I encouraged him, strongly, to have an honest conversation with his wife about what had actually been happening. He came back 3 months later looking like a different man. He said, "She cried when I told her what I had been carrying. She thought she had done something wrong." He shook his head. 4 months of both of us suffering from a conversation that took 20 minutes. That is why I do this work, because men like William, men like you, deserve to know that the solution is almost always closer than the silence suggests. Now, I know some of you are watching this and a quiet voice is saying, "Dr. Whitfield, I hear you, but I am 69 or 74, and what you are describing feels like it belongs to a chapter that has already closed for me." I want to speak directly to that thought, and I want to name it for what it is. That is not wisdom. That is resignation dressed in the language of acceptance. And I say that with complete respect for everything you have navigated to get to this point. The research on male intimate health in the 7th and 8th decades of life is unambiguous on one point. The men who continue to engage with their partners, with their own bodies, with honest conversations and deliberate biological self-care, maintain dramatically better outcomes across every relevant health marker than the men who quietly stop. Not because intimacy is the only thing that matters, but because continued engagement signals to every system in your body that you are still fully in this life. That signal matters biologically, it matters relationally, and it matters to your own sense of who you are and what remains possible. You have not passed the point where this conversation is relevant to you. If anything, you are exactly the man this conversation is for. Your body is still listening. Your relationship, if you are in one, is still responsive to genuine investment. And the information you now have is enough to begin making changes that will show up in how you feel, how you connect, and how you move through the rest of this chapter of your life. That is not a small thing, that is everything. Let's bring everything together into your clear, honest action plan. 1. Let go of the number. Replace the frequency benchmark you have been carrying with a commitment to regularity, whatever sustainable, engaged frequency looks like for your actual life. Once to 3 times per week is the research-supported range. Within that, consistency matters more than hitting a specific target. 2. If libido has declined noticeably, request a full hormonal panel from your physician: total testosterone, free testosterone, SHBG, and estradiol. Come prepared with that specific request. Do not wait for the question to be asked. 3. Support testosterone naturally this week. Begin resistance exercise if you are not already doing it. Add zinc supplementation with your evening meal, and set a consistent wake time every morning. 4. Maintain intimate activity, partnered or solo, at least once per week as a minimum biological maintenance practice. Do not allow extended gaps to become the default. Regularity is the intervention. 5. If your relationship has drifted from intimate connection, initiate one honest, curious, non-accusatory conversation this week. Not about frequency, about what each of you needs and what each of you has been afraid to say. That conversation is the intervention. 6. Address the physical factors that affect intimate reliability. Pelvic floor exercises daily, Mediterranean-style eating, quality sleep, and reduced alcohol. These are not peripheral lifestyle choices. They are the biological infrastructure on which intimate health depends. Here is your 30-day challenge. Choose 3 of these 6 actions and commit to them, consistently, honestly, without demanding perfection, for the next 30 days. Pay attention to what shifts, in your energy, in your desire, in the quality of your connection with your partner or with yourself. I believe what you notice will change how you think about this entire chapter of your life. Gentlemen, the question this video set out to answer is not really about numbers. It never was. It is about whether this part of your life still belongs to you, whether you are still a man for whom intimate connection, physical confidence, and genuine desire are available and worth pursuing. The answer is yes, without qualification, without age caveat, without asterisk. Yes. If today's conversation gave you something real, a reframe, a fact, a piece of permission you did not have before, please give this video a like. It genuinely helps this information reach the men who are sitting somewhere, asking the same questions you came here with. Subscribe to the channel so you never miss a video. I post every single week and this community matters deeply to me. And tell me in the comments, what is the one thing from today that shifted something for you? Not a general comment, the specific thing. I read every one, and your answer might be exactly what another man in this community needs to see.